If you sometimes suffer with sunburns or are looking for natural ways to support your skin and protect it from UVA, UVB, and the assorted UV rays and damage that occurs from being exposed to the sun and being outside in the spring, summer, and fall, today I'm going to share with you some really powerful resources that you probably didn't even realize are in a capsule. So I'm excited, friends, to share with you a way that you can use herbals, both internally and topically, to help support your skin and protect it from sun damage. And there are an assortment of supplements that we have actually put together in our Turmeric 3D, our T3D, that you can use both internally, and you can even open up the capsule and use it as a paste on your skin. So let me break down some of the powerful anti-inflammatory and UV protectant benefits of these items. First of all, vitamin D is a powerful resource, and you can use vitamin D both internally and topically to help both prevent sun damage and to reduce UV radiation exposure on the skin. There's a lot of clinical research that shows increasing and enhancing and optimizing your vitamin D levels internally can actually lower your risk of skin cancer, which, by the way, skin cancer is one of the worst cancers and most pervasive cancers that a lot of folks are not screening and routinely assessing within and on top of their skin. So it's important that with all of these recommendations, you make sure you have a regular dermatology appointment annually to assess skin changes and cellular changes and spots that might be suspect. So vitamin D is powerful for helping support protection of your skin and reducing the damage of the sun rays, changing the cellular makeup and minimizing the youthfulness of your skin cells. The other powerful herbal that I just absolutely love is turmeric. And curcumin is the active ingredient that is anti-inflammatory and an antioxidant that both minimizes UV sun damage. There's a lot of protectant properties that turmeric provides when you take it internally, but also if you have a sunburn, topical application of turmeric will reduce the inflammation, the swelling, and even the redness of the sunburn, and actually help support turnover of your cells so that you get over the sunburn and might even prevent peeling. Now, another powerful herbal is ginger. And studies show ginger, particularly at 12 weeks, if you take ginger internally and apply it topically, it will help reduce wrinkling and increase the skin elasticity. So overall, these particular items you're going to find here in our T3D. I'm going to share with you, we have 5,000 IUs of vitamin D3 in T3D. You take 2 capsules in the morning. And when you do a paste, you can use 1 or 2 capsules, depending on the space or the quantity of skin that we need to address. A lot of times people will be using it on their face, their neck, their chest, their hands, and the arms. So sometimes 2 to 4 capsules might be what you want to use for your paste. And then we also have a combination of the turmeric, ashwagandha, and ginger, and that equals about 1,000 milligrams. Turmeric being a fermented form of turmeric. And we also have a scenario where not only can you intake these for anti-inflammatory and UV protection, but you also can apply it topically. And I always recommend using a combination of either you use the paste, how you make it. You open up your capsules and either combine it with like a Greek yogurt, or if you want a little oil scenario, a kind of blend, you can add a little coconut oil and add that into a paste. It's going to be kind of slightly runny, but not overly runny. You want it to be liquidy. And then you just smear it on. I have one of those painted brushes, like skin face brushes. You can paint that on the area that's inflamed, red, sunburnt, or UV damaged. I'm really excited to share with you this resource because I bet you probably didn't think the Turmeric 3D is a resource for you, not just internally, but also topically to support your skin. So I hope this is helpful. Let me know if you have any specific skin health questions, and I'll be sure to answer them in the Ask the Doctor series.